Good afternoon, everyone. We are The Bridge. I'm Dipesh, this is Rachel, this is Bianca, Chris, and Kelly. We're going to talk about why we need to create a conversation for care today. We have decided to focus on Syrian refugees because of recent conflict in Syria and influx of Syrian refugees in Buffalo. Buffalo has settled 225 individuals in 2016, and 54% of Syrian refugees are suffering from severe emotional disorder, compared to 18% in American population.
And when we think about the issues related to mental health for Syrian refugees, there's a complex number of factors to consider. So specifically, Syrian refugees may have experienced pre-migration traumas, and as well as post-migration stress and adjustment to new life in the United States, all of which may or may not result in a number of different mental health symptoms. And then from a cultural perspective, the refugees' own perceptions about their symptoms of mental health and traditional methods of addressing those symptoms or coping with them might influence their ability to cope and adjust to those stressors. And then from a Western framework, we know that there are a number of different service providers that can work with this population and help address mental health concerns, but there's also a number of barriers associated with Western models of mental health, including provider implicit bias or stigma about working with different populations, and then, as we talked about in an earlier group, that model of jumping to a diagnosis, prescriptions, and treatment which might not fit with the cultural context in which the refugees are familiar. So what we wanted to look at today was how to raise this mutual understanding of mental health among both of these two groups. And some other models that have used a community participatory research approach to do this. I highlighted quotes from two research studies. One was conducted in Australia, and they looked at getting Afghan women together with researchers, mental health providers, and refugee resettlement staff to have conversations and discussions about their perceptions of health, mental health, and adjustment to their new life. And what they found was that by using this framework and including the perspectives of community stakeholders and members in the community in both designing, implementing, planning, delivering, and evaluating health services, resulted in service provision that's more in tune with community needs. And similarly, among South Sudanese refugees, another study in the United States found that doing a similar sort of approach where they had an educational piece followed by focus groups, they were able to facilitate dialogue with the South Sudanese refugee women that revealed unique suggestions for ways to improve health among this population.
So our goal is to build bridges between a UB research team and the Syrian community in Buffalo, New York, to strengthen community support and gain Syrian perspectives on these mental health issues.
And so with the models that Rachel was talking about, it brings together it brings together the refugees and the community organizations that are already in place. And so with our focus group, we hope to build that community support to explore refugee mental health concerns and needs. And so it'll strengthen and improve the community support through the liaison of the organizations to gather that information from refugees so that we can see all their perspectives and then thus use that as workshop material to further understand their needs and concerns.
So our first objective is to introduce the project goals to this community of Syrian refugees in Buffalo by October of 2017 by communicating with and establishing contacts with at least 2 ethnic community centers or religious centers where Syrian refugees are involved. This is a crucial step because it kind of sets the stage for the rest of our intervention. The activities for Objective 1 would be to identify community, religious, and ethnic organizations whom we want to work with, We're going to reach out to personal networks and connections to set up meetings. In these meetings, we'll discuss project goals and objectives, as well as identify time and locations for the focus groups to be conducted. The feedback we get from these meetings will help facilitate the focus groups that we hope to create. Ali Kadoum is one potential community representative from the Iraqi American Society who we've already been in contact with.
Okay, so our second objective is to conduct at least 3 focus groups with the Syrian refugee community representatives, religious leaders, and adult community members to discuss experiences, concerns, and needs regarding mental health by February 2018. So, objective 2 activities are really the focus of our intervention, working with faculty mentors from UB and community representatives to develop focus group questions, working with the community representatives to be the ones to establish ground rules at the start of each of the focus groups, using current evidence-based approaches for conducting focus groups, and identifying times and locations for forums to be conducted with refugees, community representatives, and providers.
So why just do a focus group? Well, the next 2 steps will kind of explain what we're hoping to get out of that. And so I'll briefly give a brief overview of step 3, and Chris will give a brief overview of objective 4. And if you have additional questions about that, we'd love to talk about it at the end. But we would be transcribing the data from the focus groups and doing thematic analysis. And really, the key piece here is that we're capturing information that we don't already have regarding the specific perceptions and voices of Syrian refugees about their own perceptions of mental health and what they need, what they would like to see in terms of support.
And then objective 4 would be to discuss and organize the information that is gathered with the UB partners and community leaders. And that would, in this stage, we would also link to other provider collaborations. And this step really focuses on, facilitating the connections and conversations between the leaders, UB, and the potential mental health providers.
So the primary benefit of the intervention is to give Syrian refugees a chance to voice their concerns regarding mental health. And by encouraging community members to participate in the process, we'll be able to better address their needs. We'll also create culturally relevant materials for mental health professionals to use in the future.
Okay, so some of the secondary benefits that we would hope to see are raising cultural awareness, reducing stigma on mental health, improving understanding between mental health providers in the Syrian community, and we believe that this can serve as a model to be adapted and used for other refugee populations if it is moved forward. So in conclusion, our goal is of strengthening community support and gaining Syrian perspectives on mental health issues will be accomplished by bringing Syrian refugees and community organizations together in focus groups, which will produce the qualitative data to create these educational workshop materials. And so then the data from the focus groups and educational workshop materials can be shared with mental health providers with the hope of increasing providers' cultural competency. So we believe that this has the long-term potential of improving mental health outcomes and also increasing the utilization of mental health services of Syrian refugees. So thank you for listening to our pitch. So we hope to be able to move forward in making a difference in the Syrian refugee community.